Next presentation is A Safer Emergency Department, the Patient Handover by Dr. Oliver George and Dr. Daisy Pamment. Can you please begin your presentation?
So hi everyone, we are really pleased to be presenting our QI project in progress, A Safer Emergency Department, the Patient Handover. So the patient handover has important implications for patient safety. And this is well referenced in the current literature, and at the RChem Annual Scientific Conference back in 2015, it was identified as a critical safety and quality problem. We felt patients were at risk at our trust due to current junior doctor handover practices based on our own first-hand experience and feedback from our colleagues. So we collected some data to evaluate the scale of the problem. Our questionnaire found just 8% of junior doctors thought current handover practices were safe. And retrospective analysis of patient notes found that just 17% of patients handed over had no documentation, and 39% did not have a documented plan at all. We also found handed over patients were spending on average almost 2 hours extra in the department when compared to those that were not. And it's well known that time in the emergency department correlates to worse patient outcomes. We created a driver diagram to explore influences on handover practices and found our primary drivers included a lack of standardization and senior input, time, documentation, and fatigue. We subsequently started a PDSA cycle to try and improve this, focusing on the drivers that we thought were easier to change. We created a standardized performer to be used for each handover and asked that all handovers were discussed with a senior due to the risk to patients of handovers. Next slide, please.
So following the intervention, junior doctor perception of handovers actually improved, but interestingly, documentation was worse, with 40% of handovers not documented and 60% did not have a documented plan. It's unclear why this is, but provided some interesting points to reflect on. It also highlights not every change introduced will lead to an improvement. A further learning point for us has been around the difficulty measuring and quantifying the handover practice. How do you measure a successful handover? Moving forwards, we aim to address some of these questions with consultant body meetings, and we are attending weekly teaching next week from feedback for our peers. Future PDSA cycles include a pre-populated handover performer on nerve centre, allowing protected handover time at the end of each shift, and introducing a departmental afternoon board round. Thank you.
Thank you, Daisy and Oliver. Again, I like your poster design, so thank you for that. And in that, there's some really good data around the scale of the problem and the safety implications of a poor handover. You've got a driver diagram in there, and you talk about how you designed that. But tell me a bit more. Who was involved in kind of creating and developing that driver diagram and the change ideas?
Yeah, so fundamentally it was the junior doctors, so they're very much involved. So our questionnaire, which has a little QR code too on our poster, there's a little box for freehand text at the bottom of that. So we asked them for input as to what they think was the problem, how do they think we can change it, what's wrong with it. Because fundamentally for a good QIP, you need to give people involved agency and autonomy and all those kind of things. So we wanted them to very much be on board with our QIP. We also discussed with the consultants as well to think what do they think is going wrong with it, how do they think we can improve it. So everyone within the department was very much involved with it and contributed to the driver diagram in essence.
Great, thank you. You said the tricky one is about how you measure the success of a handover, and I appreciate that's kind of work moving forward. But have you got any ideas? What's your sort of sense, both of you, about how would you measure a handover?
Yeah, so we had this opinion that just because a doctor says a handover is good doesn't mean it is good. Just because a doctor says a handover is bad doesn't necessarily mean it is bad. And just because a handover is documented doesn't necessarily mean it's in essence a good handover. And so we really wanted to use something to really kind of evaluate how does it impact patient safety. And so time was our proxy for that, because we know time in department is correlated to worse patient outcomes. I don't think we've quite got it right yet, but I think we're going to look at the time difference between people handed over and people not handed over and try and bring that difference down, because I think that is what could be a marker for a good handover. The problem is with time, it's open to so many confounders, and we'll have to be conscious of that. You know, is it a particularly busy week in the department? Is it a particularly busy week with rota gaps and all those kind of things, which can also influence time? And that's kind of our problem at the moment, and our sticking point is how do we really assess a successful patient handover? And there isn't much out there in the literature. A lot of the literature looks at doctor's opinion, which is great, but it doesn't really tell you what that impact is on patient safety.
Yeah, thank you. And Daisy, what about if you were going to start again? What would you do differently, do you think, if anything?
So I think it's taken us a long time to get to where we are, and I don't think we really appreciated how long it was going to take to sort of collect all the data, get everyone involved, get everyone's opinion. So I think perhaps starting the process earlier, getting everyone involved, maybe perhaps more people at an earlier stage to sort of spread the workload would have been useful. And I think just spending extra time sort of thinking about how we're going to quantify and measure whether a handover is effective, because I think we sort of thought what we initially set out was going to solve, or give us the answers, and perhaps it hasn't quite worked out, and we've only just got to that point now. So I think that's sort of delayed us really in terms of moving this project forward. But hopefully, after next week and we get some more feedback, we can start sort of implementing.
Thank you very much. That is time.
Thank you.